So today we will discuss a quiz presentation on burn, that is mainly the electric burn. The patient I have selected for this case study is suffering from a diagnosed with the electric burn. So let us start with the introduction of self and the patient. That what is your name, what is your college name, and during your posting the burn ICU, your patient name here, and with the comes in an emergency, that burn emergency, with the chief complaints of which, and you have to discuss that. And upon diagnose, your patient has been diagnosed as which burn, which category of the burn. You have to mention each and everything in the introduction part. Then there is a patient profile. In the patient profile, you have to mention all the given following biodata of the patient. Then there are the chief complaints. In the chief complaints, that you have to mention that with what chief complaints the patient has been admitted or come to the hospital in the emergency or in the OPD mode. Okay. So after that, followed by this, it includes present medical history. Present medical history, when you are examine or assess the patient at that time, what is the what are the complaints and history of the patient. Then it includes past medical history and past surgical history. In the past medical history, it includes all the history when the patient needs to be hospitalized in the past. And in the past surgical history, it includes all the surgical history that has been patient had been undergone in his past. And you have to also mention that how many years ago that has been happened. In the present medical history, that during your assessment phase, what is the if the patient has undergone any surgical history, any surgical procedure, then you have to mention in the present medical history. Then there is a family history, that what kind of family, type of family the patient had. Is he married or single or divorced or widow, and how many family members are there, and how many number of live children. Then you have to make a family tree. The scale one is for the male individual, and the circle one is for the female individual. And you have to shade the that one circle or scale that indicates that who is the patient is. Then you have to make a family chart, then socio-economic status of the family, then the personal habits of the patient, journal physical assessment, which include mental assessment and anthropometric measurements, medication, and during your assessment, what are the medication that has been administered to the patient. So basically, in the burn case, we have to fulfill the few requirement. Then the present vital signs, basically in some colleges and some instructors wants that you have to mention the vital signs for past 3 days continuously. Then here is come the head to toe examination, which includes the organs such as skin, head, face, eye, then ears, nose, mouth, neck and lungs, abdomen, back, extremities, genitalia and rectum, and neurological examination. After that, we had disease condition, that is burn. So here we have to mention each and every aspect of the disease condition, that is here it is burn. So firstly we have to define the burn, then its classification, that it is classified only into 3 types, that is first degree burn, second degree and third degree burn, along with their treatment, possible treatment. After that, what are the classification of the burns regarding on the basis of the method through which we have to measure the total body surface area of the individual. So there are three methods, that is rule of 9. Here we have to divide the individual, each and every body part, and give it a percentage. That means for the arms we have to give her 9% for each arm, anterior and posterior. Anterior and posteriorly each leg includes 18%, that is 9% for anterior and 9% for exterior. Posterior, anterior and posterior. Then there is a head and neck. There is a 9% for genitalia, 1% for anterior chest. There is 18% and posterior there is 18%. Then it includes the second method, that is London-Brondon method, which is used to estimate the total body surface area of the patient. And then last one is the Palmer method. Palmer method is used that we have to consider our palm as a 1%, and then we have to detect and measure the total body surface area of the patient. Then there are the etiological factors. One side we have to mention that what are the etiological factors that has been mentioned in the book, while on the other hand we have to mention that what are the etiological factors that are present in the patient. Chief complaint, that is signs and symptoms mentioned in the books and present in the patient. Then there is a pathophysiology for the burns. So due to any etiological factors, that mainly in the patient, in this patient it is an electrical burn. There are three types of causes that is that are the result of the etiological factors, that is inhalational injury, systemic injury, and local tissue destruction. And after that, step by step, what could be happen in the one patient. Then there is a diagnostic evaluation in the book and done on the patient, that what are the lab investigations and diagnostic evaluation has been done in the patient. Then there are the management step. See, lab investigations of the patient, current lab investigation latest. Then here are the nursing diagnosis. We have to write at least 5 nursing diagnoses and to prepare an NCP nursing care plan on at least 3 nursing diagnoses. So here are the NCP, and at the last we have to mention that what is the nursing care progress report, day 1, day 2 and day 3, that what is care you have provided and what is the outcome of that care. And at the last you have to provide the health education to the patient and the family regarding the diet, exercise, position, prevention, medication and follow-up. And the last one, you have to summarize the whole case presentation. Hope this will helpful for you, and thank you.